Go.
I'm going to say 你好 Taiwan was even.
Perfect. You passed the grade.
I'm originally from Mexico, but I do live in the U.S. I've lived in the U.S. for a very, very long time. And I moved to Miami to do the MBA program. And I ended up doing the concentration in sustainability for it, which I really enjoyed. And then I know you from the MBA program, and I think I met you in like the very first days or orientation when we went to the marketing. I think that's where I met you.
Where are you right now?
I'm in Alabama.
What is the population of the city or town that you're living in?
The town I'm in is 40,000.
How does it look like?
In regards to like lockdown, no one's doing it.
No one is doing lockdown? So people are just walking around on the street and shopping?
Yeah, there's restaurants. Like I haven't really gone out very much, but there are, like the restaurants aren't really open. They're open for takeout. But today they were opening some things. I know the hotel in the area is opening their spa tomorrow. The golf course, I live on a golf course.
Oh,
Everybody's
nice.
playing golf.
No social distance.
Not really. No one in the golf course is wearing masks.
They wear masks while playing golf?
They don't.
Oh, okay. No. What have you been doing recently? Or for this 1 month or so?
Yeah. So I think I've been a little bit more strict than a lot of people in terms of quarantining. And I was talking about it with my parents, and I think it can be cultural as well.
What do you mean cultural?
So in Mexico, things do happen, right? Like there could be a lack of medical devices or medical attention. There is a lot of poverty. There is a lot of things that when an emergency comes through, there's the mindset of we have to do whatever we think is going to be best and not look out so much for yourself. In Mexico, if they say, I don't know, some kind of devastating news will happen, everybody will try to prevent it. And we believe that pandemics do exist because you see people dying of diseases that maybe in the U.S. people don't die of, that have access to medicine. A lot of times in Mexico, people come to the U.S. to get medical treatment.
Yeah.
Not because they might not be in Mexico, but because sometimes there's certain advances in the U.S. that are better. So for me, when they said the pandemic or you have to quarantine, I really started a quarantine. And I really didn't want to go out, didn't really want to see people. And I really went out for the necessities. So when I was in Miami, I was kind of on my own in the apartment, just taking classes. I was lucky I had some face masks that I had been sent. So I was able to wear the face mask whenever I went out. So for me, I have been kind of in quarantine. I have been wearing face masks if I go out. That doesn't mean I don't go out to like the yard and like walk around, or I'm going on a little walk, but I try to stay kind of home most of the time. Scary for me was the part that you can be a carrier for 2 weeks and not know it.
No symptoms.
No symptoms at all. And so that for me was scary because if I don't know I have it, I could give it to somebody else in those 2 weeks without them knowing. So I think that kept me, even with my parents when I first came here, we kind of made it a point that I wouldn't really interact with them for about 2 weeks until we made sure that I wasn't contagious or anything like that.
Do you know how many cases in the States right now?
Oh my goodness. I know there's like over 80,000 deaths.
Right, now it's over
There's
not
over
90.
And there's over a million cases, isn't there?
Yeah. 1 million confirmed cases, 91,000 deaths.
See, to me it's crazy because even 2 days ago it was 80,000.
Yes.
So that today it's 90 is mind-boggling.
Like literally a month ago, April 4th, it's only 20,000 deaths. Now it's quadruple. More than quadruple.
And when we would look at Italy and think Italy was having a huge crisis, they were in the 4,000s, 5,000s. That the US is not taking this so much stricter when you're in 90,000 deaths. It's crazy.
Yeah. I think Miami is about like 12,000 or 16,000 confirmed cases. Do you personally know anyone who has the virus?
No, luckily I do not. And I think it's very lucky. So I haven't had a single friend that has the virus. No one in my family here or in Mexico has the virus, which is a good thing.
Yeah. What do you think the United States government is dealing with this pandemic? How do you think they do right now? A fairly good job? Nah.
No, but at the same time, I don't think they've done much from a federal government point of view. But I think states themselves have taken the initiative of closing, of making sure regulations are put in place, of trying to insure people. So the federal government has done some. They've also helped the local governments do some of it. I don't think we're at a level like France or Italy or any European country, including Taiwan or even South Korea. I don't think the US did it to that level, nor will they. And I think even just the idea of opening now, because let's say Spain is opening up or France is opening up, there is no comparison point because France and Spain closed two months before we did. Yeah. So just because they're opening, it doesn't mean we stayed close to the same amount of time. I don't know. I think it's really been up. I think the businesses have done a great job. I think corporate America and the bigger companies have done a good job. You hear of companies paying their employees more, but you also hear them, they're not just paying them more because it is a risk, but you hear of them giving them medical equipment, whether it's masks or taking their temperatures when they get to work, ensuring that health insurance will be covered for them. So I think it's really fallen into the private sector.
How about Taiwan? Do you know or read anything about Taiwan?
I read, oh my gosh, but this must have been almost a month ago, to be honest. But I know they were doing better than even New Zealand. And I know New Zealand at this point has essentially eradicated. So I know Taiwan was in the same playing field.
So do you think we got it controlled by now, or it's still out of...
The US?
Yes.
No, I don't think so. I think there's a big pressure to reopen the economy, which can be understandable, especially from a country like the US that pushes a lot for industry and money. I do not think we have it under control. I think even today, knowing that it is affecting kids, and it's affecting kids, giving them strokes or some kind of blood disease or some kind of heart condition, it just shows you how little we know about the virus or how much information is being slowed down. Because if the virus has happened since November, starting in China, to now, the idea that we didn't know or it wasn't released that kids were actually being affected in a completely different way shows you that you're not prepared to reopen, in my opinion. Can there be some reopenings? Yes, if you need to keep people employed. The US also has a lot of unemployment at the moment. I think it's like 30 million people are unemployed. Of course they need jobs, but I think there could be a smarter way of reopening.
Yeah, I read something today, and they say the states is rely on about 80 or 75% of income demand for purchasing power. So they're buying from themselves. They have only like 15% of total GDP exporting to other countries, meaning that if the cities, the government is still shutting down the economy, that is going to be a very tremendous disaster. And now we see the stocks, the bonds, and the market is really horrible. And so I can totally understand you have to reach the balance between life and economy. But that's really a tough decision, of course.
Yeah, I agree. I think in the US, people didn't wear masks unless they truly were sick. So unless it was medical doctors or you were in a construction site, and in that case it was the N95 masks. But it's not, I don't want to say it's not culturally acceptable, but it's not really done in the culture itself. And I think if we put Europe in it, it was the same thing. Masks are not something that is really worn. However, I saw France was posting, I have some friends in France, and they posted like I guess a little picture of why you should wear a mask. And I thought the numbers were so impressive. So they have like two people, one wearing a mask and one isn't. And let's say the one wearing a mask is the one who is sick. The chances of getting the other person sick, I think, were like 60%. And then they reversed it and say the one who's not sick wears the mask. The one who is sick does not wear the mask. 90% chances of getting sick.
Still high.
They do this kind of playing with them. Exactly. And then when they both wear masks, it's a 1.5% chance of transmitting the disease.
What? So
I think, yeah, it falls from
90
so high,
to 1.5.
90 and 60, and then there's a 30. I don't have my phone with me because I have the picture in there. To 1.5 if you're both wearing a mask. So I found that super impressive. And I think if more things like that were shown to people in the US or across the world, really, I think you would really then understand that it's not just about you or about the other person, but really the collaboration between both of you to not get sick. So that's how I feel about masks. I think after seeing that, I was like, it helps, you know, it helps.
Would you like to give 2 shout-outs to those medical workers, either in the States, in the world, in Taiwan, whoever is working in the front line? Do you want to say something to them?
I think just thank you, and I think it's impressive what they do. I mean, especially not with the pandemic, but I think just every day. And the idea that they can react so quickly and really try and help people, I think it's just unbelievable to have that ability as well. So a great shout out and a huge thank you, I think, to the medical workers around the world, because I think it's everywhere.
Would you like to say something to support Taiwan or people in Taiwan that who wants to contribute their efforts helping this world to go through this pandemic?
Yeah, so I think Taiwan has done a great job. Again, even if I haven't read the news in a little bit, I know when I last left them or heard from them, they were doing a wonderful job. And I think people were complying and realized that it was something bigger than themselves and that it wasn't just about their ego, but also about those around them. So I think congratulations to that country, because they've done an amazing job of really stabilizing something that other countries are really, really struggling to keep under control.
That's it. We're done.
We're done.
Good luck.
Thank you too.
Bye.
Bye. Stay safe.
Stay
Wear
safe.
your mask.
Yeah. 假如你喜欢我的影片的话，欢迎按赞、留言、分享，并且订阅我的频道。我们下支影片再见。